Next up is Dannine Johnson, Progressive Maryland Community Schools Policy.
Good evening, board members. My name is Dannine Johnson, and I'm here today representing Progressive Maryland to speak on Board Policy 1100, Community Schools, and the revisions made to that policy during the November 16th Policy and Governance Committee meeting. We all understand the importance of community schools in Prince George's County. Community schools bring together relationships and assets of neighborhoods to efficiently and effectively utilize resources to advance the well-being of children and families by providing wraparound services. When making and updating policy, we should keep in mind those two words, efficiently and effectively. Revisions to policy should take into account what no longer is being done in our schools, what does not work in our schools, and to what newly established laws the policy should align. Regarding the standards section revision, may I suggest a clarification on the number of Board of Education members to the Community Schools Steering Committee. The revision suggests 3 board members where 1 is a student member. An efficient number would be two board members where 1 would be the student member. Missing from the steering committee is a parent from a community school. This parent member should be separate and apart from the parent representing the Board of Education's Parent and Community Advisory Council. Why not explicitly include a community school parent on the steering committee? Parents play an important role in community schools and should have a seat at the table. Furthermore, if the policy is being updated to bring it into alignment with House Bill 1300, Blueprint for Maryland's Future, I suggest 2 items for addition. 1, add to the definition section the verbiage, a dedicated staff member to coordinate and support programs that address out-of-school learning barriers for students and families. 2, add to the standards section the following verbiage, have a professional health care practitioner to provide full-time coverage during school hours, including any extended learning time, who is a licensed physician, a licensed physician's assistant, or a licensed registered nurse practicing within the scope of the healthcare practitioner's license. These changes will not hamper the work of community schools, but instead bring about a more consistent way that aligns with the current model. I hope you take these suggestions into consideration. Thank you.
Thank you, Ms. Johnson.